secure medical system and strengthen public trust. Our moderator for this session is Eduvigis Ortiz, cybersecurity head Iberia at Eraneos and founder and president Women Cyber Spain, and the panelists Bianca Pop, Arnault Barichella, and Evangelos Markatos. Eduvigis is an internationally recognized cybersecurity strategist with over 2 decades of experience in digital resilience, critical infrastructure protection, and diversity leadership in tech. She has advised both public and private organizations on how to embed security into the digital transformation processes, including in healthcare. So thank you so much, Eduvigis, and a warm welcome to the stage.
Thank you very much, everyone, to be here. For the visitors, sorry that we don't have a sunny day in Madrid today, but please stay some more days and you will see a sunny Madrid that is beautiful. So I would like to introduce my panelists because it is really a theme that I very close, because when we talk about cybersecurity, that is a top priority for any business, and is one of the main issues that we have to take into account, because business has to continue, you know, but we are talking about business continuity, about rentability, but when we talk about the health sector, we are talking more. We are talking about this availability that we need to have, because we are talking about human lives. And we are talking about this surgery that needs to be done for someone to survive, and these 24 hours for 7 days, 65 days over a year. That is very unique for this sector. And unfortunately, we've been looking at a lot of things that happen. We can name the pandemic. And well, that was, in a sense, good for the health and cybersecurity joint prioritization, because we see that really cybersecurity is something that we need to have in our highest regard, because we are talking about private data, we are talking about these people that needs to work in an ecosystem, all the providers, the supply chain, a lot of things we need to take into account, and that is why we would like to today discuss this with these outstanding speakers, panelists that we have here. So I would like to introduce them to you. Evangelos Markatos, as it was said, is the head of distributed computing system at Cybersecurity, a fourth in Greece, living in a beautiful Crete. That's very nice also. Evangelos is one of Europe's leading researchers in network security. Well, that's data protection and threat intelligence. That's something that we need to really work around, because all this critical infrastructure needs to be resilient, and especially in the health sector. So thank you very much, Evangelos. I invite you to come here by my side. Then I would like to introduce you also to Bianca Pop. Is a project officer at the European Patients Forum. Also, this very important, the voice of the patient here. And she's working in a lot of European digital health landscapes, working to promote trust, transparency, and patient empowerment in the digital innovation field. Thank you, Bianca. And finally, we have here Arnault Barichella. There is a cybersecurity expert at Delors Institute. Arnault brings an academic and strategic perspective on cyber policy and digital ethics, analyzing how European governance frameworks can enhance healthcare preparedness and resilience. So welcome, very expert voices to have this discussion here today. Thank you for being here, for visiting us in Madrid. So hope you can stay longer. So we are going to start this discussion. First, we are going to talk to Angelos. Based on your research and policy experiences, what do you see is the most critical vulnerability currently affecting healthcare systems? And if you have the power that you do to advise any hospital in the first 90 days of a plan for this cyber resilience, what would be your recommendations?
Yeah, thank you for this. Thank you for the introduction and for the invitation. This is a very interesting question, and probably it's in the mind of several chief information security officers of hospitals. What are the first steps? I would like to take a step back and talk a little bit about cyber attackers, cyber criminals. Cyber attackers and cyber criminals go for the weakest link, and sometimes the weakest link is technology, and they try to exploit technology. And in some other cases, the weakest link are people, human beings. And they try to attack human beings, to exploit human beings through phishing, scam, or other ways. So maybe one of the first steps is to train people, educate people, their staff, the doctors, nurses, but also the patients as well, to alert them about these possible scams, these cyber attackers, that cyber attackers may be after them, maybe after their data. I guess we all receive phishing emails every day from our banks or from our organizations, but we don't receive phishing emails from our hospitals. But eventually, I'm saying, we are going to receive such phishing emails pretending to be from hospitals or from the government, talking about our health data, etc., etc. So I guess train people and educate people and alert them is one of the main priorities. Also, maybe a first step in a hospital would be to do a maturity assessment. Maturity assessment is an exercise where you talk to, say, responsible people and ask them a few questions about, do you have passwords? Do you have your data in locked computers, in locked rooms, things like that? Do you use two-factor authentication? And it's a very long list of questions, basically trying to understand what is the status, maturity assessment, what's the maturity with respect to cybersecurity in your organization. Much like when you install, say, an alarm, a burglar alarm in your house, a person comes and looks at the doors and the windows and say, oh, you have doors here, windows where the burglars can come in. Do you lock your doors? Do you close your windows when you leave? Where do you have a spare key? Things like that. And this maturity assessment will help them understand where they are and what they need to do in order to get to their target. Thanks.
That's it. As we always said, the person, the user-centric approach is very important in any sector, but here even more. And now, Arnault, we would like you to explain to us how the European Union and national policies, especially NIS2, that is very on the top of our priorities lately, help health organizations to move from minimal compliance to be really resilient. And what governance models do you believe are the most effective to balance innovation, data, and sharing information in cybersecurity healthcare?
So thank you very much. It's a great pleasure to be here. So thank you for the invitation. So in a nutshell, there's been great progress in the cyber domain over the last few years in Europe, yet there are still a number of weaknesses. This is linked to the fact that cyber policy is linked to defense, which remains a national prerogative. That means that there's only so much that the European Union can do. And so in spite of the latest legislation, NIS2, there are still a number of disparities so like across all member states. And so some countries like France, for example, have the resources and the infrastructure to enact far-reaching policies at the national level, and others do not. And this framework of a multi-speed Europe is problematic in that it creates weak links in some countries where viruses can penetrate the network before spreading to the other member states. So one key topic is to evolve from the current preference of the EU of directives to enact instead of regulations, which are directly applicable across all member states. So the European Union has begun to do that. We saw the Cyber Resilience Act and the Cyber Solidarity Act, which are regulations, but the NIS directive is still a directive and thus perpetuates the problem of a multi-speed Europe. So then another topic is that due to this lack of competences, the policies in the cyber domain for the EU are general in scope. Just to give you an example, the NIS2 directive covers up to 18 different sectors. So it's quite a generalist approach. So it's very important to complement NIS2 with ambitious policies at the national level that target specifically the healthcare sector. The healthcare sector has its own particularities and thus necessitates its own specific framework at the national level. Thank you.
That's it. That's a big risk also we have. We are many countries and the priorities are different in each country. And also the critical sectors are also different, and many of the countries are 99% like Spain with small and medium companies, and that is also a big challenge because the supply chain in the healthcare sector, in any sector, is a lot. We have an ecosystem, and if you have small companies that are not under any regulation, then you have those open windows, open doors that can be a big problem in any of the ecosystem leakage. So Bianca, you are representing the voice of the patient, and we would like you to walk us through those key elements that build or erode trust in digital health system and how we can communicate cybersecurity measures in a way that patients feel safer and empowered instead of overwhelmed. Well, that's a big challenge. That is a big challenge. But just tell us.
It's a big question indeed. So thank you very much for having me, and a big thank you to Digital Europe for their kind invitation. It's been a pleasure. I would, before I jump into the question, I would like to take a moment to introduce the audience in the room and also the attendees online to our organization. EPF stands for European Patients Forum. We are a disease-agnostic umbrella patient organization representing disease-specific patient organizations across Europe, as well as national coalitions of patient organizations. We have big patient community. We do a lot of things in EPF. Part of our day-to-day work is, of course, the EU-funded projects. We have quite a long, extensive experience in EU-funded projects, whether they are funded under Horizon Europe, so research and innovation, IHI, but also EU for Health programs. My topic is digital health, but also health technology assessment. So besides the EU-funded projects, we also have the policy work. Of course, we are closely monitoring what's happening at the EU level, so within the EU health policy, whether we talk about digital health data, AMR, HTA, and so on. Of course, I'm really glad to hear that education was already mentioned as a key cornerstone already in this discussion. And EPF is actually working on capacity building activities, and this is a strong component of our work. We really advocate and help patient organizations and the patient community to kind of build their knowledge and share with them, translate, I would say, the technical information into lay language so they can easily understand and digest a bit the technical and legal jargon. I do speak legalese because I have a legal background, but we cannot expect patients and the general public to kind of understand what the primary and secondary use of data means. So I would also like to take a moment to mention data saves lives. It was already mentioned yesterday from one of our speakers in the plenary session, and I think it's it's really one of the key and our success story, because it was already translated at a national level in Germany and in the Netherlands. So for those who don't know what DSL is about, this is a multi-stakeholder initiative that was born in and was launched back in 2019. So it's been already 6 years already, and we did a lot of things. We have 4 toolkits available. The first one is very much focusing on introducing the patient and patient communities to what health data, big data means. And then one of our recent toolkits that was published actually in August this year is very much related to the EHDS. So we basically translated what primary use, secondary use, opt-out, opt-in, so all the technical and this regulatory terminology into lay language, plain language to patients, in order for them to easily access the information, because again they don't speak legalese. And then so when, just to go back to your question, so when patients enter the healthcare system, they place enormous trust, not only to treat their disease, but also to kind of protect their data. And I know it was mentioned several times in a lot of events, also in the recent EMA workshop on artificial intelligence, that AI is already there. You cannot have AI-driven solutions if data is not there. So digital health data is creating huge and important opportunities. And patients are to deliver better care, and patients are generally aware of the potential and the huge potential of digital health data, because it translates into more personalized treatment, easier access to medical information. There is a huge potential also for healthcare professionals to kind of access the medical information, not to mention the impact at a policy making level and also in the research field, especially for the secondary use of data. But yet alongside this excitement and potential, there are of course many concerns. Cyber incidents and cybersecurity is key. And from what I've heard from our patient community is that they really want to know how securely their data is stored, who is collecting it, for which purposes. Of course, the opt-out is important, but in the end, it turns out it's very much about trust. And there is one sentence that stands with me after the EPF Congress that happened a few days ago in Brussels. And it was brought up by a youth voice who is actually a medical student, but also a youth board member of EPF. And basically what he said was that trust is the foundation and data is a proxy. And I think it beautifully captures the rationale behind the whole process. So we need transparency and also safe data protection digital practices that are more important than ever, because it was already mentioned in the plenary yesterday, healthcare is indeed one of the most vulnerable sectors.
And that is right, because it's more vulnerable also because in traditionally health sector is being well behind in all the IT development and IT transformation. So many hospitals and health centers have legacy systems, and that's easier for attackers to go after that. So that is why sometimes we are surprised. So we say, why the health sector have so many attacks? Well, because there is a lot of IT transformation that needs to be done, and maybe that's one of the also the things that is a key, that sometimes when you have priorities so high as to save lives, the other things don't look that important, no? But IT transformation also in hospitals and clinics are very important, so the health sector can be ahead and be more protected, and we can have this trust throughout the system. So I would like you to give us some view. What is your vision about that, Evangelos? because it is true that we've been talking about that it's really need to go all over the sector, more modernization of all the IT, because that's a vulnerability.
Yeah. That's a very good point. Let me take a step back and reflect a little bit on this. Up till now, or up till today, say data are stored in data centers in the cloud, and usually data centers have trained personnel, and they take care of their cybersecurity. They have cybersecurity measures like firewalls, antivirus, things like that. And the recent directive, the NIS2, will make it's basically a law. It will be transposed law to member states, so it will make it mandatory to protect that data. And I'm not particularly worried about that. What I'm worried about is a second aspect of the European health data space. And the European health data space gives, say, patients the opportunities to download their data and share their data with their doctors, pharmacists, and maybe get a second opinion, things like that. So in the near future, we'll see that data will start moving from the big data centers that are generally protected into less protected devices like our laptops, our smartphones, maybe even on social networks, maybe on Facebook, Snapchat, things like that. And these devices are less protected and probably more vulnerable to cyber attackers. So my feeling is that data within the big data centers will be protected, say by law, so they will have to be protected. But when they start moving into personal devices, there are less protection there, and that's why we need to educate patients, everybody, including doctors, nurses, and patients, more importantly, what they do with their data. And I would like to add something more, that cyber criminals are very interested in your medical data, in your health data. And you may wonder, why would cyber criminals be interested in my health data? Why would they be interested in my cholesterol level? That's ridiculous. Cyber criminals are not interested in my cholesterol level.
They are.
Actually, there is a valid answer to that. Cyber criminals are not interested in your cholesterol level, but they are interested in your medical record, because the medical record contains lots of data, lots of personal data: name, surname, email address, telephone, your spouse, your allergies, lots of personal data that can be used for identity theft and for fraud. I have to tell you that today medical records are being sold in the black market. Yes. So cyber criminals sell and purchase medical records in the black market. Traditionally, in the black market, cyber criminals traded credit cards, because they can use credit card to purchase something, a service, a product. And I usually ask this question: do you know what is more expensive in the black market, a medical record or a credit card?
A medical record,
yeah,
for sure.
A credit card in the black market goes for a few dollars, a few euros, 3, 4, 5 euros, because banks are very quick at protecting their customers with the credit card. So in order to get a credit card in the black market, you have to pay 5 euros and whatever you can do within a short time interval. But do you know how much medical records go in the black market? 10 euros, 20 euros, 50 euros, what? Yeah. 250 euros in the average. 250, so 50 times more than a credit card. So it's a lot of money. So cyber criminals are very interested in getting that data because of the identity theft and the fraud. So, yeah.
That is right. So I don't know if you would like to add something, Arnault or Bianca?
Maybe just to build on what you said. So indeed, cybersecurity is more than, let's say, IT challenge. It's like a patient safety issue. And I think, so we are very much welcoming the cybersecurity resilience, and then we see, there is a lot of effort into overcoming this risk. But I think it was mentioned already, this co-creation and stakeholder communication, like to what extent it is so important to kind of sit at the same table and tackle all these issues and then come up with solutions. And speaking of solutions, I would maybe like to give you and share with you one example, something that I've recently worked on. So EPF is part of the of a new funded project called EDITA. What we are trying to do in EDITA is to develop the fit for the first fit-for-purpose health technology assessment for digital health technologies. It's a 4-year project led by Cattolica University. It's very ambitious, and well, the outcome of the project will be an EDITA framework for health technology assessment agency as well as manufacturers. And I know the Cybersecurity Resilience Act, so the CRA, is very much tailored to manufacturers. But also in EDITA, we set up this patient advisory group, and we really try to kind of tackle their needs and requirements. They were already captured in a report. I think it's the feedback loop is very, very important. And then there is also an exercise linking it to the cybersecurity, led by NSC, so the Norwegian Research Center, as well as DNV, the notified body of the European Commission for EU markets. So what we did, because I think it's really important when developing these AI-driven digital innovation solutions to kind of, from the beginning, make sure that they are secured by design and protected by design. Because otherwise it's even harder to kind of tackle all these risks. And so part of this exercise was led by DNV and NSC was to assess the existed regulatory frameworks at EU level, and then assess to what extent and what are the implications for the EDITA, what the implications are for the EDITA framework. And then after that, because we also have patient advisory group in the project, which is coordinated by EPF, we ask them to join to have kind of a joint meeting and explain them like what are the barriers, the challenges, to what extent it is so important for them to know that this is CRA compliant and so on, not only EHDS of course. But I think it's a beautiful exercise, and secured by design tools are key.
Yeah, very key. Actually, it's one of the big challenges we have in the industry, not just in the health sector. It's every sector that is faced with that challenge. So Arnault, would you like to add something in that
Yes,
line?
just a small point. So both of you have mentioned the fact that cyber criminality is one of the main factors behind the rise in cyber attacks. I would also like to point out that it's not only criminals. Also, there are foreign and
Yes.
hostile nation states which are conducting these cyber attacks in many ways. Since the annexation of Crimea more than 10 years ago, Russia has been waging a cyber war on NATO and the West. But it's not just Russia; it's also peers like China, North Korea, so also like Iran. So there is a global cyber war, and it reflects the broader confrontation between democracies and dictatorships. And so, for example, a number of the major cyber attacks which have impacted Europe over the last couple of years have been conducted by Russia in continuation of its invasion of Ukraine. That was especially true during COVID. COVID meant that our healthcare sectors were overwhelmed, and so they represented a prime target for cyber attacks as part of Russia's campaign to destabilize Europe and the West more generally. And so cyber attacks have the advantage of concealing the assailant, especially through the use of false flags, which makes it possible for hackers to conduct large-scale attacks without openly revealing themselves. And that's why it's become a privileged tool, by countries like Russia to destabilize the West without openly revealing themselves. So it's a covert way to destabilize the West.
Well, every time we look at the geopolitical landscape, we say, wow, how many challenges we need to face, and on top of the challenges we have in our everyday lives and whatever work we do, in whatever sector we are. And going to talk about cybersecurity as a protection, continuing with you or not, any organization need to have the cybersecurity director plan. That is like the first stage, the basics, after you take this maturity level test. And now that we have this regulation that I really think they are accelerators, because if not, you don't prioritize anything. So that's why the regulation, I think, is key. So sectors and companies are prioritizing cybersecurity in their everyday priorities. And then we need to go to basics also. The ISO 27000, that is something that it's been a long time in the market, and it's like the basics for anything. So, but not many companies, not many hospitals, not many clinics have gone through this certification. What would you advise as being the first practical steps so the healthcare sector can improve the cybersecurity posture?
Great. Well, thank you very much. That's a great question. So yes, of course, NIS2 is important. Yes, the global ISO standards are important. Yet, as I've said at the beginning of this roundtable, national legislation is key. That is because NIS2 is very general and covers up to 18 sectors, and also the ISO, it's difficult to have a follow-up, checkups. So that's why national legislation is key. So I think that when a hospital devises a cyber director plan, they must look at ISO, at NIS2, but also at their national regulations. So I think that a key first step is to conduct a comprehensive review of the level of cyber protection in the hospital. This must always be done by an external operator for the purposes of impartiality. And so it is fundamental to assess to what extent the software is up to date, and to what extent the hospital is still relying on legacy like equipment and software. And so then there must be a comprehensive upgrade of the software and the equipment based on the assessment. And so it must be followed up by regular upgrades. For the software, for example, it must be done at a minimum, a new update once per month, but preferably more regularly than that. So that's like in a nutshell, I think what the first steps should be, but it's also very important for the hospital to make sure that there is a dedicated IT team, because too often, cyber concerns are relegated to a secondary level of importance in hospitals. So there must be a dedicated team. So that would involve, probably hiring more people to work as part of the IT team. And this team also has to be in a capacity to establish very effective channels of communication with national authorities. So under the NIS2 directive, each member state has to develop a so-called CSIRT, or Computer Security and Incident Response Team, as well as a national contact point. So there must be direct and effective channels of communication between the IT team in the hospital with this CSIRT and the national contact point in order to be able to report on a regular basis. And then, of course, in cases of more serious cyber breaches, there must also be direct channels of communication with the authorities at the EU level. That includes the NIS Cooperation Group, which was established by the NIS2 directive, along with, of course, the ENISA organization, which was revamped and upgraded by the EU Cybersecurity Act with a permanent mandate and an enhanced budget and stuff.
We can see that you are very passionate about this regulation. I like that, and maybe we can go a step back, because sometimes cybersecurity people talk about NIS2, ISO 27000, and then people, they don't have a clue what we were talking about. So network infrastructure security, that's what we are talking about. And we have a previous version, and now we have the second version, that is NIS2, and we, in the different countries, have to comply with that European regulation. And that's what we were talking about, that we are at different speeds, because all the countries has to be translated, the regulation by now, but not many of the countries have done it. Spain is getting there, but we are working on that. And we can see that this is a collaboration work, no, Evangelos? Because we need to be aware that the IT people have all the technicalities, but also all the practitioners, the doctors, the people working in hospital and clinics, and even the health ministry. We have to be all together looking up to be in this trust environment. So I would like you, Evangelos, to tell us how this collaboration, do you think, could work better?
Yes. So I think that the NIS2 and the transposition to the local law will make it mandatory to use it in hospitals. So that's the basis. So that is, we have to do it. I mean, there's no other way. We have to do it. Now, in addition, in having to do something, you need also to convince people that it's a good thing to do. It's not only that it's a legal thing, but it's also a good thing, so they could feel good about that. You have to convince the patients that it is good for them by giving all the, by explaining and helping them capitalize on all the advantages that the European health data space will give them. And you also need to explain that to doctors and nurses. And maybe the last one is the most difficult one, because if they have some time to spend, they prefer to spend it with the patient than to spend it in front of a computer doing something with the computer and the data. But one example I usually say is that when you operate, say you are a doctor and you operate on a patient, you sterilize your instrument. You don't use dirty instruments to operate on a patient. You sterilize. Say you are a dentist and you're going to do a tooth extraction or something. You sterilize everything, because if you use dirty instruments, then the patient will get infected. You need to do the same thing with your digital instruments. You need to sterilize your digital instruments as well. That is, your computers, your digital environment should also be sterilized. That is, have an antivirus. Oh, say antivirus, yeah. Have an antivirus, firewall, be protected. Because if it's not, say, digitally sterilized, it may affect the safety of the patient. It's not about the security of the data, it's the safety of the patient. And if you're approaching, say, the patients and their data with infected computers, then eventually you affect their safety. And you don't want to do that if you're a doctor or a nurse.
That's right. Bianca, would you
I
step on this?
I couldn't agree more with what you've said, and also I really like this idea of and approach of sterilized digital environment. I think it's key, but also just to go back to what Arnault said about medical devices. So indeed, they are like very, the top-ranked vulnerable digital health technologies. So we need, we really much welcome, the regulatory work led at the EU level, but also it has to be indeed, harmonized and really implemented at a national level. So a lot of effort is needed on that front. And going back to the communication, you need, because Evangelos mentioned that we really need to kind of spread the word and pass the message to the patient and patient communities. There is one report from Eurostat that says that basically 45% of the EU population is lacking digital skills. That's very alarming. I think we should start from there, and this is key. Part of our job is to kind of, really emphasize and help patients and patient community to kind of build their skills. Because you can have, a very efficient system in place, but if they don't have the digital skills and the necessary skills to kind of cope with what's expected, it's pointless. Not to mention the quality of data that was several times mentioned in the plenary yesterday.
Yeah, that's what from Women for Cyber, especially, we really work a lot on that awareness and that going to basics, because sometimes we think that at work, in the different sectors, you need to sterilize your digital devices, But then you, in your personal life, you don't think that your devices, your tablet, your phone, you need to also have these digital health tips so you can use these health digital tips for your devices, so you are going to be more protected, and then that is going to impact your work and your devices at work, because then you are the same person. So that is why it's important to have this awareness at societal level. So we have these digital competences, and the basics are really important. Sometimes we say, well, if you use the multi-factor at work, so you should use multi-factor also in your devices for your social media, and also for accompanying your youngsters and your eldest. That's something that we need to do. We need to be also ambassadors of cybersecurity at our personal level also, because sometimes that behaviors, good behaviors, are going to impact everything you do, because we are connected with devices since the very first moment we open our eyes until we go to bed. So collaboration is key in that, and that's how all these organizations at national and European levels are helping us to achieve this. So, well, time flies, and we can be talking about cybersecurity and the health sector, and how the trust of the patients, and all the challenges we have. But I would like to pick more your brain, Evangelos. So, because, for example, when you are talking about what a strong cybersecurity culture look like, what do you think about?
I would say being, say, street smart on cyberspace. When you walk out there in the streets and you end up, say, in a shady neighborhood, you say, oh, okay, this is not a good place for me to be, I'm going to move around. The same thing happens in cyberspace. When you receive an email that looks shady, don't respond to that, or try to verify. So again, be street smart on cyberspace. It's not full of good people. There are good people and there are bad people, much like in real life as well. So be digitally street smart.
Yeah, so that, well, we have a lot of head shots in this round table. I like that, Evangelos. I will store that for my next round table. Arnault, what about you?
So I think that the European Union's Cyber Resilience Act tried to implement a culture of cyber security by design from all stages of the life cycle of the project, for both like hardware and for software like equipment. And I think that it's very important for governments at the national level to build upon this, to ensure that medical devices include this culture of cyber security by design, so throughout all phases of the life cycle of products.
I like that also. So what about you, Bianca?
I would go for clear communication when this incident happened, but also tackle the risks and overcome this risk first. Of course, patient involvement, feedback loop, and co-design of these digital health technologies together with patients, and really treat them as equal stakeholders. This is already happening at EU level in so many fields, and we are really glad that you can already see some concrete and tangible results.
Yeah, that is something that since we are in this European Digital Health Summit, maybe also it's interesting to put on the table what different programs or resources small hospitals and different health sector institutions can call up to Europe and see how they can help them to be more protective and more cyber resilient. So let's start with you, Arnault, since you are the policy expert.
So I come from France, and in France there's already a big divide between the hospital network and infrastructure in the large cities, and in more rural parts of the country, it's referred to as medical deserts. There are not enough doctors. There are not enough hospitals as soon as you leave the big cities. So France is a very centralized country, so Paris tends to amalgamate most of the resources, but I think it's a problem that applies to most member states across the European Union. So it's a very serious problem. And so in France, for example, people in some cases have to drive for hours before they can reach a decent hospital to get operated. So the European Union has tried to tackle this challenge through a number of different frameworks, chief amongst them being the European Regional Development Fund. So the idea of this framework is to use resources to develop poor regions. So it's not done by country, it's done by regions, i.e. some resources can be taken, say, from Paris to be given to more rural parts of France. And so that's a very good model, but of course it's an institution that remains chronically underfunded and also underdeveloped. So I think that it's essential to allocate more resources to the European Regional Development Fund, and also perhaps even to create a specific funding envelope just for the healthcare sector, because the COVID pandemic was able to highlight the dangers associated with this two-speed Europe between the prosperous urban parts of Europe and the more rural zones.
Wow, that sounds interesting. So do you know any other initiative to help clinics and the health sector institutions?
ENISA recently published a document about a month ago in October, a month and a half, where they outline, say, best practices for hospitals. So what should hospitals do with respect to cybersecurity, best practices. And that's a very good document, and especially, say, for small hospitals who cannot really afford to hire expensive consultants and stuff. So this is a very good start. And I would also would like to mention, say, the Cybersecurity Agency of Belgium, where they have published a whole framework, a maturity assessment framework in English that you can use and try to understand what is your cybersecurity posture today. They also have marks and numbers, so if you say you are above that number, you are okay, but if you are below that number, you have to work on this, this, and that. And it's a very good way to understand what are your needs and what you have to work on. So those two resources, they are both in English, so they're very useful.
Oh, what about you, Bianca? Are you aware of any resources like that?
I mean, I would go for DSL Data Saves Lives toolkit for sure, because I'm bringing the patient perspective here. So it would be, I mean, my dream would be to have this initiative really at EU. Now it exists, at it's led by EPF, but it would be nice to also see this at the nation level. It already exists in the Netherlands and Germany, but it would be so great to see that this is actually happening in many other countries, and I think it's a very hands-on and useful resources, and it would be a pity not to kind of make the most of it. If you want to translate the toolkits into your native language, please approach EPF. I'm available during the coffee break. It's really a useful resources, and again, it would be a pity not to take advantage of this. And just to go back to the EDITA framework that is being developed under the EDITA project, it's very much related to HTA, but they are also, part of our job would also be to, come up with these educational resources, not only for patients, but also for other stakeholders, manufacturers, healthcare professionals, and so on. So a lot of things are happening in many other projects. We have, the resources are there. We just need to kind of make the most of it, and or also make patients and patient community aware that they are already existing.
Well, that's all very interesting and very useful. So maybe since we are here with in this digital summit, so maybe to summarize all these resources, so it's available for all the participants. That would be very useful. In Spain, I can say that the National Institute of Cybersecurity have a lot of resources for small companies, including all the health sector, so they can have this first assessment of what they have because the first thing is you know where you are, so you can understand with the regulation that you need to comply, where you need to be, and work on that journey of transformation. So that is something that is also very useful to look up the National Institute of Cybersecurity, that I think in almost every country you have this organism to help all the society to be more digital competent and more protected. So thank you very much, all of you, for this rich conversation. I think we have a little time, so we are not that much. So if anyone in the audience want to have any question or any comments, very welcome. Well, very good. We have someone raising their hand. Thank you very much. So there. We don't have a mic right there.
Hi, thank you. I have a quick question. Before the new EU regulation comes into force, when all of us will have access to our medical records and we can share them, we all know that, at least on anecdotal evidence, that people are, and even doctors, are uploading medical records onto LLMs constantly in order to get second or more opinions. And my question to the panel is this an area that is being considered for regulation under cybersecurity, or if not, should it be?
Well, you are the policy maker. Go for it.
So unfortunately, it's well known that ChatGPT is spying on you. So there are major data breaches. That's partly because these are products which are developed by American companies, and there's very little legislation in America in the domain of privacy and data protection. It's a cultural difference. In America, there's more of a belief in the free market economy, that any form of regulation is bad for entrepreneurship and for innovation, whereas in Europe, there's a different mindset, more of a mixed form of capitalism, more Keynesian. And so as a result, there are laws in the European Union. There's the GDPR, there's the AI Act, but it arguably doesn't go far enough. In fact, the opposite is taking place at the moment. There's an ongoing process of so-called simplification under von der Leyen's new mandate, and a lot of voices have come out to say that this could be a cover for a deregulation. So not only is it not well protected, but it's actually getting worse. And so I think that there is an urgent need to establish a stricter frameworks to regulate privacy protection for large language models.
Yeah, and also now we have also a certification at ISO 2000 that it covers the organization to go through all this shadow IT and see how people can upload really sensitive data to all these AI large models that we have around. So there is a big challenge there. You have any comment on that, Evangelos?
This was a complex scenario, and you need to break into several different steps. The first step is, did the doctor have the permission to upload the data to LLM or to any other model? And if the answer is yes, then okay, the doctor had the permission to do it. If the answer is no, then we stop there. It's the first step that has the problem. Just the LLM that has the problem. It's the first step the doctor didn't have the permission. Now, let's go into LLMs. I think AI has moved into our lives and we cannot avoid that. But I would like to separate the LLMs into two big domains. The first domain is the public LLMs out there, which we train with our data and we don't know what they do with our data. And probably, even if the doctor did have permission, they shouldn't do that. They shouldn't use patient data to train foreign LLMs that they don't know what they do with the data. And the second thing is that we may have, say, private LLMs or company-specific LLMs or hospital-specific LLMs or university-specific LLMs where their job is exactly that, to be trained with the data of patients in order to create, say, new detection models, in order to find new drugs or new medicine for patients. And that's a good use of LLMs. And I just wanted to break your scenario into several different pieces and say that that some of those are good and some others are not good. Yeah, that's it.
Well, the use is the key. So Bianca, do you have any insight on that?
Yeah, maybe just very quickly. I know it was mentioned that probably certification, like a new certification scheme, would be in a way a good option for these digital health technologies, whether we talk about telemedicine, AI, or mobile health applications, or any other AI-driven solution. We don't have only AI, but also generative AI and a lot of LLMs happening. And also patients need to kind of keep the pace with this. It's not easy, and I think we also need safeguards.
Well, thank you very much. It's been a really interesting roundtable. Thank you. And well, I just would like you to keep this message. We are responsible for the cybersecurity, each one of us. It's not just IT responsibility, it's everyone's responsibility. Thank you.
And with this message, which is very important, yeah, we are closing up to go to the coffee break, but just as an insightful discussion. So we are just continuing next session here with Breakout C1, Practical Pathways, Micro-Credentials, and Training for Digital Health Skills. So for those attending session 3 in Breakout C2, Safeguarding Access to Antibiotics, AML, and Supply Resilience will be in Ambassador's room, and now we have the coffee break. But just was thinking one thing. I'm a clinician, so I'm used I had to admit, I never thought it was my responsibility. I thought it was IT people responsibility. So, but if my director attaches it to the risk assessment and to assessment of infections in the hospital, and then I have cybersecurity, it becomes my responsibility too. So I think we should attach it to other strings that clinicians and nurses are already familiar with, and so it becomes automatically a different perspective. So maybe
right.
that it could be a way. So let's go to the break now. And
thank you.